Hello everyone. My name is Miklo Alcala, and I will be discussing the health effects of cockroach allergen exposure in children in this research presentation. To begin, the health issue at hand is often overlooked. 17 to 41% of child and adult populations show high prevalences of cockroach allergies. Exposure leads to heightened sensitization, skin allergies, and more serious conditions such as asthma. In fact, 60 to 80% of asthmatic children are illustrated to have increased sensitivity to cockroach allergens. Consequently, people who experience cockroach-induced stress are more likely to panic, increasing the severity of asthmatic symptoms. Children are the most at-risk population in the United States. 85% of U.S. urban and inner-city homes have detectable cockroach allergens in units such as the living room, bedroom, and kitchen. Ethnic minorities and low-income individuals, especially African American and Hispanic or Latino communities, have increased susceptibility to cockroach-induced asthma and are more likely to live in rundown, unregulated homes. Cockroach particles can be inhaled and travel to the lungs. This can provoke epithelial damage and inflammation, as well as create imbalances in the adaptive immune system. Genetics in combination with environmental factors elicit asthma and other diseases. Thus, detection and diagnosis are important to mitigate the potency of illness at the early stages. A 2018 study published by Rhee and colleagues found that different concentrations of particles in urban homes influence heightened allergic conditions and asthma. The figure shown here represents data regarding children and adolescents who are consistently exposed to different allergens and the associated frequency of hospitalizations, emergency department visits, acute office visits, and specialist visits. As presented, cockroach allergens are considered the most alarming factor for negative health outcomes. They increase the probability of hospitalizations and healthcare visits in comparison to other allergens derived from mice, pets, dust, plants, and food. Evidence-based interventions should also consider improving knowledge and changing the attitudes of healthcare providers, as well as the general population, about the health effects of cockroach exposure. Education has shown to improve and induce positive behavioral changes within the most affected populations. This data is concerning, therefore general prevention strategies should be practiced. These include inspection, sanitation, trapping, or using chemicals to control cockroach infestations. Since integrated pest management techniques are quite expensive, placing insecticidal bait in hotspot areas of the home can reduce the number of cockroaches. This alternative is inexpensive, has low toxic levels, and is easily accessible. And here are my references. Thank you.